So through all of the stages we described in laminitis, you have different clinical signs. In the prodrome, also stage 1, you have systemic signs, so things related to body temperature, heart rate, respiratory, but the mucous membranes, they're red rather than being pale in most illnesses. Restlessness, sweating, muscle trembling, I think because of the pain, and also just more unusual things, so just keep an eye out for them. In the acute stage, you have locomotion signs. So yes, you do have an increased temperature in one of the hooves, and I think it's because of the inflammation. You'll feel digital pulses, so more blood flow in that area, I think because of the inflammatory cells we mentioned, the healing. Usually the forelimbs are most commonly affected, you'll see later. And you'll see shifting weight from one limb to another, and lameness as well, so not weight bearing, that kind of thing. Anyway, so as you can see, I mentioned the 4 feet before. They're usually like positioned towards the front. They're sort of tilted. They have a stiff gait. They don't move because they're uncomfortable. And when they're lying down, they also get decubital ulcers. I can't speak. Don't know why that's there. Yeah, and in the acute stage, you don't just get locomotion signs, you also have local signs. So you have painful withdrawal response to hoof tester pressures. So basically, if you put anything normal like this, if you're cleaning the hoof, they're going to be in pain, so they'll withdraw the hoof. You'll also see swelling and pain at the heels, increased digital pulses, already mentioned. Now, at the chronic stage, you also have local signs. And you'll see deformation of the hoof capsule, and you'll see this concave appearance of the dorsal hoof wall. You'll see abnormal growth rings, and I think this is sort of what they're talking about. And they're more widely spaced in the heel than in the toe. The sole will be flat because of downward pressure, and the white line is said may be wider, and the sole horn and you'll also get disruption of the frog. So this is this structure here. You'll also see in the chronic stage, even on the outside, it just looks really bad, doesn't it? But you'll see a groove at the junction of the skin, ulcers at the coronary band, like here, which is awful. Broken hoof pastanaxis. I mean, I think that's just something you look at for the chronic form of laminitis. DDFT contracture, so I assume that's like dorsal displacement, and this leads to secondary flexural deformity, so I assume it just affects the ankle. It also says lameness decreases. So in terms of diagnosis, yeah, obviously you have to look at the stance, do a digital exam, like do you feel is it warm, is there a higher pulse, history. Now if you do a nerve block of the palmar digital side, so the side that's touching the floor, and it doesn't improve the lameness, but an abaxial sesamoid nerve block abolishes it, it's likely that there's a laminar component to the digital pain. So basically, if you block the nerves in this side that's touching the ground, and you don't see a difference, but you actually block the nerves on the side of the hooves, sort of towards the top, then how do I say this? Yeah, and it does abolish the pain. Laminitis is probably a component. There's also the hoof tester response and, of course, x-rays. So, yeah. Yeah, you can see it's placed on a block of this sort of angle here. Yeah, it's as close to the sole as possible. So it says, like, in terms of radiology, the palmar angle should be 3 to 5 degrees. So really, really little. It says the dorsal hoof to the dorsal bone margin is like 15 to 19 millimeters. I feel like this could come up. The distance between the extensor and the coronet is 14 millimeters, so very similar to the dorsal hoof to dorsal bone margin. And the distance from the dorso-dorsal tip, so I assume it's this, and the palmar process to the distal phalanx, of the ground surface of the sole is 20 to 23 millimeters, and you don't have any radiolucent zones because, of course, this is all bone, so it's radio opaque. So in terms of x-rays, what you also see is not just all of those measurements, but you also see a widening between the dorsal hoof wall and the parietal surface of the distal phalanx, so a large distance between here and here. I think even there are some like green lines that show that distance, and it also shows an increased vertical distance from the proximal aspect of the extensor process to the firm proximal border of the hoof wall. Okay, so it's saying increased distance from the, I assume like a tendon or a muscle, extensor muscle from the proximal border of the hoof wall. So I assume it's like something here. I'm not sure. Anyway, so you also have grading in laminitis. And this is all based on these things. Let's see if there's more. No. Okay, so hoof pain, gait, and horn wall. So if you're just talking about the 2 grades, so the hoof pain's only slight, whereas it's a bit more in the grade 2. Gait. The gait is basically normal, but it might be tilted in like a tight circle, or they turn in a tight circle. Whereas in grade 2, they're not even willing to move in a tight circle. The horn wall, so this is probably more about maybe if it's concave, or if, how do I put this? Yeah, anyway, and maybe in the x-rays. So in grade 1, it could be normal, and you might see grooves later. Okay, so these are the rings I mentioned on the outside. In grade 2, you'll see grooves appear later, and yeah, you'll also see bruises when you trim the hooves. Now we'll talk about the obal grades of laminitis.